Hi everyone, my name is Michael Erickson and I'm a site reliability engineer at Intelligent Medical Objects. When I'm not obsessing about production for work, you'll probably find me riding with my two kids on our family e-bike around Chicago. And one of my goals for this year is to bike to as many of the Chicago neighborhoods as possible. There are 77 official neighborhoods in total, and to eat a meal there. As we know from working with service level objectives, 100% is never a realistic goal, and so we'll see what we can do before winter arrives. One of the ways we at IMO help our clinical partners to deliver patient care is by reducing their documentation burden and also allowing more time for patient engagement. If your doctor is using an electronic health record, the odds are she's using IMO. Lastly, one of the things my undergraduate degree in English literature instilled in me was the value of a good story. And the story I'd like to tell today is called From Availability to User Happiness, an Introduction to Service Level Objectives That Matter. It's one that may be familiar to many of you who are at the start of your organizational transformation towards service level objectives. For those of you who are farther along, I hope it reminds you of how much progress you've actually made. To introduce you to the protagonist in our story, this is our application. It loads in as an iframe inside an electronic health record application that's provided by an EHR vendor. We partner with those electronic health record vendors to provide this functionality to clinical users, so we don't necessarily control either the execution context or the security context that this web application runs inside of. Part of what that latter point means is that some of the default tooling, the out-of-the-box telemetry that we would use to support other applications in our portfolio wasn't available and enabled by default. As we started to roll this application out to some of our early adopter sites, we started to hear negative feedback about application performance. An analyst at one of those sites told us during a customer call, "If you told me it would always take 3 to 5 seconds to load, the doctors won't love it, but they'll tolerate it." And then they went on to say that the problem right now for them is that it wasn't just slow to load the page, sometimes well in excess of that 3 to 5 second threshold. It was also contributing to overall sluggishness for the rest of the patient chart inside of the electronic health record. Another clinical user at the same site described the impact on his day-to-day work this way. "Sometimes I need to add 10 conditions and it takes 10 seconds to add each condition." And they went on to describe the impact for them by saying that that wait time after each user action was cutting into their limited patient prep time. And that's the exact opposite of the value we intend to deliver as a company, reducing documentation burden for clinicians and also allowing more time for patient engagement. And yet, when we look at the application health dashboard, we could see that we were 100% available and not much else. We knew our users weren't happy. We were measuring and reporting almost exclusively on availability, but we were hearing from those customer calls that other application behaviors were just as important. And we primarily heard 3 things during those calls. First, users wanted the page load to complete in less than 5 seconds. Second, adding a new patient condition should complete in less than 4 seconds. And finally, removing a patient condition should also complete in less than 4 seconds. Our conversations with users were also critical to help us identify the right target thresholds for our indicators. Users seem to understand that patient charts with more complex patient histories might take longer to load, and so we set our initial target at 80% of total events. No need to chase 95 and 99% of total events if our users were willing to tolerate a slightly lower threshold. And we also knew that if we were satisfying that 80% threshold and still hearing complaints, we could always revisit the objectives and indicators. If we weren't hearing complaints, we were probably in the right ballpark for our service level objectives. And now that we had a much better idea of what was acceptable performance to users, it was time to see if we could deliver on that experience. During this time, we were laser focused on potential changes that would dramatically improve impact for one or more of our service level indicators. But first, we needed to add application telemetry to actually measure user experience against those indicators. If you remember from earlier in the story, one of the limitations on our initial response was that we couldn't see much in our application telemetry outside of availability, and so we needed to start to fill out that perspective on application health, one that incorporated what mattered to users. The telemetry we collected allowed us to see some opportunities along two primary dimensions. The first was improved resource utilization for page load. That was contributing to both the poor load times for our application and also to the overall sluggishness of the EHR application. The second was to stabilize the performance impact of a third-party API that we integrated with. And that was particularly problematic for adding and removing patient conditions on more complex patient charts. That telemetry we collected also allowed us to quickly invalidate some of our initial assumptions about the root causes of poor performance, things like the number of asynchronous logging calls we made. Were those refactors and system changes things that we wanted to eventually accomplish? Absolutely, but because they weren't directly contributing to the poor application performance that our users were talking about, it wasn't necessarily the right time to execute against those system changes. As we shipped each of the improvements I just described, we started to immediately see the improved user experience in our telemetry. Along the way, as you can see from the rightmost graph, we're actually able to downgrade our initial target for page load from 5 seconds to 12 seconds. Part of the improvements that we made around improved resource utilization allowed our application to load in the background for users instead of on their first application click. And so they were willing to tolerate slightly slower load times because most of that was happening in the background for them. So now that we are seeing improvements in our application telemetry, it was time to check back in with users on a customer call. By gosh, I think they've got it. And this quote was from the same clinician who earlier noted the impact of poor application performance on their patient care experience. And the chief medical information officer at that same site would periodically call their lead analyst to gush at how much more responsive the application was, and they slowly started to resume their implementation timeline. The improvements we made dramatically improved user satisfaction for our applications. We'll continue to refine our SLOs as the install base grows or as user expectations change, but for now, we have happy users. So how did we learn? First, putting engineers on customer calls allowed us to tighten the feedback loop and hear firsthand what mattered most to our users. Second, we created indicators and objectives based on that firsthand feedback. For our users, performance mattered just as much, if not more, than availability, and so we prioritized work that improved those specific application behaviors. Happier users, happier engineers, a happier business. Thanks so much for joining me for this story about our journey from availability to user happiness, but that's all the time I've got. For now, it's time to sign off and take the kids out for a ride.